as you know, in the past I have been reluctant to discuss things that have been happening in the rest homes and the nursing homes, because I believe that many of these things involve people and are personal, and therefore I don't want to sort of get lots of details out in the media. But I do believe that it was important, in view of some of the comments that have been made, that I should make a statement with respect to Summerhaven. The Ministry of Health and Seniors has a duty to care for and protect Bermuda's residents. The Ministry has been actively investigating and taking action on complaints about the treatment of residents of Summerhaven. Summerhaven is a private care home for persons with disabilities. It is not a government facility. After spending many months working with the Summerhaven board to improve conditions at the home, an administrator from the ministry was appointed in February 2016. For 3 months, that person addressed many of the complaints and ensured the facility was registered as a residential care home. This is a requirement under law for anyone providing board and personal care to 2 or more unconnected persons who are disabled. Continued work with Summerhaven board by the ministry appointed administrator ensured a privately hired Summerhaven administrator was appointed in May 2016. There was a positive transition from the government-appointed administrator to the Summerhaven administrator. The ministry, however, continued to monitor Summerhaven, and positive changes were observed, and feedback from the residents were also positive. In October 2016, after 4 months in the position, the Summerhaven administrator was dismissed. Residents held a protest reported in the media. Since October, the ministry received complaints which escalated in frequency and severity, which were investigated. The ministry concluded that there was serious risk to the lives, health, and well-being of the residents at the facility. Following an application to the court under Section 16(1)(c) of the Residential Care Homes and Nursing Home Act 1999, on 7th of December, a court order was made that the ministry administer Summerhaven and care for the residents until such time that the ministry is satisfied that Summerhaven is operating in accordance with the Act and regulations. To be clear, this is an action that has never been taken. The magistrate recognized that many months of supported government efforts took place to remedy the situation, but agreed with the chief medical officer that residents were still at serious risk. We acted as we must, in the best interest of the residents. In addition, since October, the ministry ensured that the board conducted a recruitment process for a new administrator, and that process remains underway. The ministry has been concerned about the lack of protection for vulnerable adults and is actively exploring the establishment of the Office of the Public Guardian, as stated in the 2015 throne speech. The ministry's goal is to ensure legislated adult protection of vulnerable persons, whether it is in residential facilities or in the community. Legislative changes will aim to ensure that it's not only persons in institutional settings who are protected. The work has been progressing, and the legislation to better protect vulnerable persons as well as persons in residential care homes and legislative amendments will be presented when finalized. In the interim, the Ministry's Aging and Disability Services have continued to receive and investigate complaints received, whether in the community or in residential care homes, to ensure vulnerable persons are protected, and to work with residential care homes to improve standards and care quality. The government is committed to looking after the most vulnerable members of our society. To me, this is a measure of caring and a sophisticated society. We need to meet the needs of Bermuda's seniors and people with physical, cognitive, or mental disabilities such as dementia and Alzheimer's disease. And this is exactly what we're doing through Aging and Disability Services and through our long-term care plan under the Bermuda Health Strategy 2014 to 2019. There can be no more important work than making sure we care for those who need our support. The government will continue to protect Summerhaven residents while working alongside the private facility to ensure a favorable outcome. Thank you very much.
Will this lead to any extra increasing costs for the inmates themselves?
For first of all, I have wrestled with calling them patients, but they're residents, and definitely they're not inmates. But at the current time, we are obviously reviewing everything with respect to Summerhaven, and what the residents will pay is part and parcel of this. But more importantly, we need to make sure that what they're paying now, they are getting what is required under the Act and what is appropriate for them. So I can't answer that in a perspective view.
Are there any other Summerhavens out there?
Well, let's look at this. We review residential homes all the time. And as I mentioned, I think a year or so ago, statutory, we're only required to do one visit. But we do two unannounced. And we have done the re-registration again this year. Some of the residents perhaps might have had some conditional registration, and the conditional registration would have things to do with things which are relating to, could be fire, it could be relating to care. So I'm not saying that there aren't facilities out there that might have some regulations that they have to live up to, but all I can say is that we continue to work with all of them. We have meetings on a regular basis to bring the standards up. And I must take the opportunity to remind the public, if they don't know, there's at least 8 of them out there that are working on accreditation to turn around and bring their standards up, because standards have changed. And what we have in the Act now, which is 15 years old, is nowhere near what we want to have going forward. Going forward, we have to deal with things that are relating to the care and quality of life of the individuals, and not just about the bricks and mortars and the nursing, staffing, etc. So we're working on it.
Is there any time frame for how long this particular circumstances at Summerhaven is going to last?
I don't know that. The reason I say I don't know that is because we are obviously putting the administrators in there, and some of the things that they're looking at immediately relates to the staffing that are already there, the type of care plans that are required for the staff, and also the fact that an administrator had been recruited. And that will be a key issue, because if the board can come up with a recruiter that has the expertise and the qualities that can work with our appointed administrator to move it forward, then it's easier to transition. And it's all about the will and the willingness, and therefore I'm going on the basis that we're going to try and accelerate it as much as we can, but make sure that we do the right thing.
Are there any regrets the government didn't act sooner, being there have been complaints on and off about Summerhaven since at least 2008?
Well, all I can say, and then obviously I can't speak back to 2008, part and parcel of all of this relates to the whole question of resources and regulations and what are you able to do within the law. And many times you're trying to work with individuals to try and make them understand that the changes that they need to make, and sometimes you don't always have what I call the stick to deal with it, so you're having to use the carrot. And I think that by and large, we have made changes, and all of the rest homes and residential care homes, I think, have progressed. And as we said, there was a time where we were getting comments, Aging and Disability Services were getting comments that things were great, they were enjoying themselves. I think you might have even seen some articles in your paper about the residents talking about how they were feeling. And it's all about its progress. And we can't turn around and say at any one point in time we are where we need to be, because things can slip forward the same way they have to move forward.
Minister, using the carrot when vulnerable people are at risk may to some people be an inadequate response. Is there anything that you think the ministry could have done better in terms of its response?
Well, when I say using the carrot, obviously you're working with the board, you're having your administrator in there, you are making sure they understand what the Act says in terms of requirements. You're trying to encourage the staff as well as the residents to take ownership of things that need to be done. And I think that you can always turn around and you can look and say, could you have done something differently? But I think the mere fact that we actually got it registered and we actually got it to a stage where the residents were feeling good about what was there, I think that that's significant. The sad part about it is that something happened and therefore the gains that we made have been lost. But that doesn't mean that we're not going to continue to work on this. And as I said, more importantly, as we go forward and we try and get everybody to take responsibility for the fact that they have to care for these individuals and the residents themselves involved in the process, then we'll continue to do so.
And how long do you think the interim arrangement, the administration, will be in place?
As I just said to the other reporter, it really is dependent on how quickly they get an administrator on board. An ad has been in the paper. We are obviously will be working with their board to talk about what needs to be done. And in the meantime, even though we're in the process of making recommendations with respect to amending the acts, the various acts, that doesn't mean we're still not out there trying to, on a softly basis, trying to get people to turn around and do some of the things that are coming down the pike. So that way, and we have consultations with them. We had our long-term care symposium about 2 weeks ago, and lots of people came out, and that gave people an opportunity to hear about what we're doing, to hear about what changes will be coming in the Act, to hear about what things will be happening with respect to themselves as administrators, what we're doing in terms of caregivers, because we have to remind everybody we prefer to have people aging at home rather than in care facilities. And in the meantime, I think people have to also recognize that when you start off at one level in facility A, whether you like it or not, there is a natural progression which is resulting in some deterioration, whether it be Alzheimer's or just the natural aging process. And so the facilities have to have ranges of staff and ranges of care patterns. And so it's all something we're working on. So we'll try and make sure that if people are interested, go on our website. We have, on the government website, we have something about long-term care, and more people can see what's being done.